as you know, we have already done, or like you have already covered all the topics related to physical diagnosis. And today we are going to start the first topic, which is the lab diagnosis, lab diagnostics. So in this one, uh, we are going to cover all the laboratory tests, lab tests, which are done and which are helpful in diagnosis, in diagnosing certain like many conditions. So of course, there is a lot of lab tests nowadays which are available, which are related to blood, and of course, like the one which are related to blood are of many kind, starting from blood CP, which is blood complete picture. In America, they call it as CBC, complete blood count, or blood CP, or full blood count FBC. So there are many names for that. Then, like we can take the bloods to check the liver function test. We can take the blood to check the renal function test. We can check the cholesterol levels. We can check the ESR or CRP. We can check the electrolyte levels. We can take the blood to do atrial blood gases. So a lot of range of tests are there. We can take the blood to check hormonal levels, drug levels, culture and sensitivity. So simply like there is a lot of blood tests. There is urine test, same like that. There is stool test. There is imagings like X-ray, CT scan, MRIs. There is cardiological test. There is neurological test. There is pathological test. So this lecture is more about the introduction to the lab diagnostics. Okay. And of course, like we are not going to cover, for example, radiology in detail. Why? Uh, like you already have done radiology as a subject, but okay, we will talk about in one of the lecture. We will talk about the X-rays. We will talk about the CT scans. We will talk about the MRIs. We will talk about how to approach them. Or we will not talk about, for example, in detail the pathology. Like of course, cannot be. We cannot talk about that all because you had done pathology as a different subject. So of course, like we have just limited lectures for lab diagnostics to cover all the topics. But yes, I am going to tell you the approach, how we can approach different conditions, and how uh, they are helpful in diagnosing different conditions. So to talk about the lab diagnostics, like this is more of a, you can say, introduction to lab or laboratory tests or diagnostics simply. Okay, so this lecture is more about like why we are studying this, like what's the importance of this subject. So of course, like lab tests, they are valuable aids in making a diagnosis. Nowadays, of course, more and more medicine is depending on the lab diagnosis. So now, one thing which will come during these our lectures, okay, about the different tests, okay, is you have done the subject of epidemiology, right, or statistics. In that one, you have done what is sensitivity and what is specificity. So the concept of sensitivity and specificity is very important. Okay, because many times, like I will be talking about that. So already you guys had done this thing, okay, but I'm talking about like you must have a good concept about this thing, because all the lab tests which we use, okay, they are implemented in medicine based on the specificity or sensitivity of the test. Um, and of course, like these are the things which describe the value of the test. Like either this test is valuable to be implemented or to be used to diagnose of to the diagnosis of certain condition or not. Let me give you an example. For example, there are certain conditions in which like that diagnosis of certain conditions are done on lab testings. For example, these days, the world is in pandemic of COVID-19. Now, what the people are having? The people are having pneumonia. Okay. Now, do you think this is the first time all the people are having pneumonia? No, many people have pneumonia before. Okay, and there are different causes of pneumonia, as we have already covered in infectious diseases. There is viral causes of pneumonia. There is bacterial causes of pneumonia. There is fungal causes of pneumonia. So pneumonia can be caused by certain infections. You can say that there is a thing called as chemical pneumonitis, right? So um, see, when we are making the diagnosis of pneumonia, we go for the history, we go for the physical examination. During the physical examination, what we can found is, okay, maybe the patient chest have uh, uh, crackles or wheezing or absent breath sounds in one of the lobe of the liver. Maybe on history, the patient will be having fever, dyspnea. Okay, maybe on Oscar, like on percussion, you will found a dull note if there is consolidation of one of the lobe. So see, you are collecting different history points and you are collecting different clinical examination points, right? And these are telling you that okay, the patient do have pneumonia. But my question here is like after getting all these things, are you going to label the patient that the patient have COVID-19? No. Why? You will say that the patient picture, clinical picture looks like pneumonia. So to confirm that, what you will go for? You are going for X-ray. Okay. You are going for X-ray. Now on X-ray, or you can go for a CT scan, for example. Now on CT scan or X-ray, you found the changes in the lung tissue. Now again, my question is, do you say that the patient have COVID-19? Again, no. Okay. On X-ray or CT scan, you will be sure that okay, this patient have pneumonia based on the X-ray as well as the CT scan findings. Depends on what you are going for, right? You took the blood test and you found okay, the lymphocytes are raised, the ESR is raised, and all the things are raised, right? Again, my question is, do you label the patient with COVID-19? No. Why? Because you had made your mind on clinical examination that the patient had pneumonia. You had done the investigations, and on investigations, now you know that the patient have what you can say pneumonia. But what kind of pneumonia? Again, you are not 100% sure. See, after that, now they have defined a test. They said, okay, once you are going to collect a nasopharyngeal swab from the patient, okay, and once they will test that sample in the laboratory, and if they will found a virus in which the virus genetic makeup looks like what's the genetic makeup of is of COVID-19 or the coronavirus, right? So yes, that means that this patient have the COVID pneumonia, right? So see how we can be sure uh, by the nasopharyngeal testing. Okay, of course, like they run PCR. That's okay. That's a different discussion because right now I'm just giving the introduction. Now my question is to know how well you diagnose the patient with COVID-19 depends on the sensitivity or the specificity of the test that test, right? Again, like for many of you who don't have like I am sure you had done this subject of epidemiology and statistics, right? But for example, the sensitivity is the measure of the percentage of individuals with the disease who have positive test results. Okay, the percentage of individual with a disease who have a positive test result, which means like people with the disease who are correctly identified by the procedure will be the sensitivity of that test, whereas the specificity is the measure of the percentage of people without the disease who have negative test results. I will repeat, the measure of the percentage of people without the disease who have negative test results, which means healthy individuals correctly and if identified as free of the disease. If the test is 100% sensitive, if the test is 100% sensitive, I'm not talking about this COVID test, I'm just talking about any XYZ tests which are used in the labs. If any test is 100% sensitive and the test result is negative, it can be said with certainty that the person does not have the disease because there will be no false negative results. Okay, I think I should write these things down for you guys. Sensitivity. Okay, so what I was saying about this one, it is the measure of the percentage of individuals with disease who have positive test result. Okay. Okay. And what is specificity? It is the measure of the percentage of people without the disease who have negative test result. Okay, so which means now if the test is 100% sensitive, it means that the test is measuring all those individuals who have disease and the test is giving positive results. So there is no chances that this result is going to give you a false negative result because the test is 100% sensitive. But if the test is, for example, 90% sensitive, so it means like it is going to give you a lot of false negative results, means it is going to skip a lot of people who actually have disease, but the test failed to recognize those tests, right? A very, very important concept, guys. Okay. So when the sensitivity of the test is increased, the false negative results decreases. Okay. So same thing with specificity. If the test is very much specific, there will be very few false positive results. Okay. If the test is highly sensitive, there will be almost no or very low false negative results. Whereas when the test is highly specific, there will be low or very few false positive results. Okay. So the ideal test should be 100% sensitive and 100% specific, right? So uh, for example, let's talk about a very very common test which people keep on doing at home, pregnancy test. Okay, uh, now uh, pregnancy, for example, if the pregnancy test is there, that is so accurate that it is positive in every woman who is pregnant, and it never came back as positive in a woman who is never not pregnant. What it means, like, this test is highly sensitive and highly specific, but in reality, or unfortunately, no such test basically exist. Okay, why? Because some of the tests, they are highly sensitive, but some of the tests, they are highly specific. So there is no testing like this which are highly specific and highly sensitive. The normal value of the test is based on, like, what they do or check, get the results in 95% of the population tested. Okay, so which means, like, they usually skip a lot of, what you can say, patients who get undiagnosed or missed easily, right? So very important to know what is sensitivity, very important to know what is specificity, very important to know what is false positive, false negative. Okay, these are very 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 important concepts. So okay, nowadays, the medicine is more and more dependent on lab diagnosis, right? And nowadays, of course, like, they are inventing number of tests, right? Like, you can see again the example of COVID-19. They have developed a lot of tests, within a matter of few days or few weeks, you can say. So of course, like, nowadays, there is blood test, there is urine test, there is automated analyzers are there, machines which can analyze the blood and the urine within seconds or minutes. Okay, and give you the results immediately. And a lot of testings are, like, included in the medicine day by day. So one of the thing, for example, uh, some of the tests, they are positive or negative, but some of the tests, they are like this, like, there is some normal range. For example, if I will show you this one, for example, uh, the normal value of WBCs in the body, in the blood, is between 4,000 to 11,000 cubic per millimeter cube, right? So now, or per cubic millimeter. Now, see, it's a range. Okay, it's not positive or negative, but it's a range. For example, if you are going for AIDS testing, there could be positive and negative, but this one is a range. Okay, so there are tests which are either positive or negative, and there are blood tests or urine tests are which are defined according to the range. Okay, I'm showing you this thing, and maybe are you whatever books you're following, you can see, like, the values are not same, but they are more or less somehow close to each other. For example, you will find the books where this value is between 4,000 to 10,000. You will find the books where these values will be like between 4,000 to 11,000. Don't get confused. That's completely fine. You will find the books where the values of ESR will be not between 2 to 12, rather maybe 2 to 14. Okay, so that's completely fine. So, of course, right now I'm just developing your concept, your orientation towards this thing. So, of course, like, and it's not like this, that if one of the tests is coming out of the range, it means like the person is not healthy, because uh, there are some healthy people who have values outside the range. Okay, and there are individuals who have the disease, but their values are still in this range. Okay, of course, like, with experience you would know, or with knowledge you would know what I'm talking about. So uh, much of the tests these days, they are standardized according to the international system of units, or SI units, right? But again, the issue comes, like, depending on which book you are referring or studying. I will give you the example of glucose levels. Uh, some of the countries, they follow millimole per liter. Some of the books follows, some of the countries follows milligram per deciliter. So nowadays, of course, like the internet have solved much of the issues. Like you can just Google and you can convert the values easily, because there are online converters are also there. So of course, like these are things are also there. So when we will, like, of course, continue more, discuss more, you will understand more and more and more. So then there is what you can say, different imagings, instruments, and procedures which are used in diagnostics. For example, um, colonoscopy. What is colonoscopy? They are going to pass a tube inside the rectum, and they are going to visualize your colon in from inside. Again, it's a diagnostic test, because what they are doing, they are using that scope or that instrument which have a small camera, and sometimes they are putting inside your esophagus, sometimes they are putting inside your rectum, okay, or the patient rectum, simply to see. Or for example, there is a test called as biopsy. What is that? They are going to take tissue from the patient body, just to study that, examine that. So of course, like these type of lab diagnoses are also there. X-rays are there, and nowadays, by the way, X-rays are becoming highly effective, because and nowadays the X-rays are, due to good technology, there is good quality X-rays which are there. CT scans are there, MRIs are there, PET scans are there. So of course, like, and then they have done the contrast imagings as well, like in which they can put a contrast in your body through the blood, through in the body cavities, and then they will take the images. So of course, like nowadays, a lot of advances are there in electronics or science, and that's why, like, there is a lot of tests available nowadays. Like echocardiography, ultrasound, of course, like they are all there. So uh, now, lab diagnostics, or you can say clinical lab diagnostics. Okay, of course, like it's not just one field. There is no specialization like this, that this person is a specialist in labs. It's not like this. Rather, it's like this in reality, that there are pathologists who do who are the one who basically see the things under the microscope, or do the biopsies, or tell you about the structures. There is uh, clinical pathology. So under clinical pathology, there are what you can say certain subfields, like clinical microbiology. Like these are the people who study the microorganisms, like bacteria, viruses, parasites. Then there is clinical chemistry. Like these are the people who uh, see the other things. Hematologists are there, who are those who basically deal with the blood cells. Okay. Then of course, like the genetics is also there. So a lot of what you can say subfields are there of this thing. Okay. So of course, you could be a pathologist. You could be a clinical biochemist. People could be lab assistants. There could be biomedical scientists. There could be medical lab assistants. There could be histochemical technicians. So you can say uh, there is a lot of uh, different type of people who work in the labs uh, to diagnose the conditions. So of course, like with what you can say with during this lecture, we are going to um, take a look on all these things, okay, one by one. So what's the point of doing diagnosis? It is like the simply to formulate a diagnosis, okay. So simply again, like it's very important to make the orientation of the medical students. So what's lab diagnosis do, or how it helps, you can say. So you take the history, you got some history points on history, you do clinical examination, you got some clues, and then you decided, okay, now you have to formulate a diagnosis, or you have like certain differential diagnosis in your mind. For example, many of the conditions, they are diagnosed clinically, no investigations are needed. There are okay, and it's not like this, like you always go by history and clinical examination, but for example, uh, when you go to different country, you undergo health checkups, right? So for example, a person, a worker who wanted to go some other country to work, and his work people, they ask him, okay, go and do some test, okay, we just want to see either you are healthy or not. And he went to for the lab test, and they tested for HIV, they test him for hepatitis B, hepatitis C, they test him for syphilis, they took CBC, they do ultrasound, they do X-ray and all this stuff. So see, maybe the person thinks like he's completely normal, or person think like he's completely healthy, but maybe the test result come back as positive for HIV, or positive for hepatitis C, or positive for hepatitis B, or the X-ray shows some findings. Okay, so see, like in this way, of course, like a person could be, or you can say the labs could be the first line thing which is diagnosing the patient in that case. Okay, so of course, like here I'm giving you one example, but it's not always the case, because in reality, of course, we get encountered with different things, right? So simply to formulate a diagnosis, uh, of course, you will take in consideration your clinical decision making, and you want to formulate a diagnosis. So then you will advise some tests, okay. And so you're a clinician, you got a patient, and you gather the information by medical history, and then you do physical or mental examination, whatever. And you have a list of possible causes of certain disorder. So what we call that thing, we call it as differential diagnosis, right? Now you know that, okay, uh, to um, establish your what you can say differential diagnosis, or to formulate a diagnosis, now you will say that, okay, or you will list uh, some tests, okay, to either diagnose or identify certain conditions or diseases, okay. And of course, like then of course you were going to discard some of the conditions, or maybe you can add some of the conditions, or maybe you will go for further testing, okay. When we will study about CBC, like, you will get a lot of information, like how we diagnose anemias, how we diagnose, for example, blood cancer. So of course, it is step by step. You don't go for all the investigations in one day, okay. Rather, you see the tech, get the result of one thing, and then you decide on further step. So of course, like the list of those tests will further uh, guide the physician, like how to move forward for diagnosis or for treatment, okay. So this is how uh, lab diagnosis help, okay. So you will advise us some test, and then either you make a diagnosis, or you will go for treatment, Okay, and of course, like during treatment, maybe you need further testing. Okay, to know like how the patient is doing. So this is the importance of the lab test, by the way. So, for example, appendicitis. Appendicitis is one of the conditions which is mostly diagnosed clinically, but to you can say make our suspicions of having appendicitis stronger, or to get some more clues, we can go for ultrasonography. We can go for CBC. But of course, like they are not the diagnostic test, but rather they will help you in that, in making the diagnosis. Okay. So now there are like how they define the test. For example, there are tests which are called as gold standard tests. Now, what is a gold standard test? Of course, a test which is particularly used to diagnose certain condition. And if the gold standard test says that the person have condition, so the research shows that yes, this test come back positive in this condition. So this thing. Some of the tests are called as diagnostic tests. What are diagnostic tests? They uh, they establish uh, the presence of the disease without much doubts. Okay, and of course, like that again depends on the same thing that which I was talking in the start, the sensitivity and the specificity of the test. So and now again one more thing, guys. We should be cautious one when we are advising test. Why? Because if the patient don't need, we don't go for the test. For example, imaging, especially because we don't want to uh, uh, expose the patient to more and more radiations. Okay, so you can say ordering too many tests poses significant danger. Uh, why? Because there could be many things like cost is one of the problem. Falsely abnormal test results could be one of the problem, or there are many other things like why to do more and more tests like when the patient doesn't need. So always like the tests are decided logically. So that's how like the clinicians or the doctors they make like they decide that the patient needs certain testings or they don't need any testings. Okay, so that depends on the knowledge of the physician, or knowledge of the doctor simply, or the surgeon, who else is there, or even a psychiatrist. Okay, so again, sometimes the tests are used to rule out certain conditions, of course. So that's important. Some of the time, the tests are done to check the effect of the medication. Sometimes the tests are done to check the side effect of the medications. Okay, so like this way. So now, because you don't know much about the conditions, many examples they come into my mind, but I think okay, I don't want to give you them right now because maybe you won't understand. For example, one thing which was coming in my mind was about fatigue. The people who come with fatigue, uh, fatigue or tiredness, for example, for 15 days or 1 month. Now there is many causes which causes fatigue or tiredness, like anemias can cause, infections can cause, malignancies can cause, psychological problems can cause, medications can give a side effect like this. So uh, of course, like we take the history, we do the clinical examination. If we think, for example, the patient don't need that, of course we don't go for that. Okay, so that's the important thing I wanted to put in your mind. So uh, rest, guys, in the diagnostics like introduction, um, I don't think so. Like we have to talk. What you can say? Um, oh yes, well, we can talk one more thing in this lecture. That is about. I show you this one, right? This is called as a CBC. Now, in this slide, you can see I have included a report of CBC. And nowadays, good thing is they always give the reference values, okay, according to the labs, and These values are not exactly same for all the labs. Like depending on what methods they are using, there could be a little difference in these readings. Okay, and in China, by the way, exactly they give you a report like this with high or low written, so that if you are in a hurry, you can simply see. Or sometimes they make these things dark so that you can directly focus on that thing. So I don't know like which books you are reading or using, but what I can tell you is uh, in the start or in the end of the books, you can found things written like this one, normal values or hematology, normal values. Then you can read the normal values of LFTs or the normal values of clotting profile, the normal values of cholesterol, the normal values of electrolytes, so on and so forth, right? Things like in almost all the books they have written. For example, Davidson or Baylis, they PJ Kumar, they give the normal values either at the start or in the end in the form of tables, just to tell you. Even like when you go for USMLE exams, STEPS exams, it's a computer-based exam, so you can access the normal values anytime in the computer. On the top corner, they have a section. If you want to refer to the normal values, you can just click and see the normal values of anything. Okay, so nowadays in the hospital, what I have seen is uh, the use of internet is very very much common, and uh, not in all part of the world, but in many countries, the hospitals are all interconnected, and we just put the patient ID in the system. Uh, we can get access to all his investigations which are done, and we can see the values, results with the normal values written in front of them. So, and even like if it is not there for sure, like Google is a smartphone. Everyone have smartphones, so Google have solved this issue. But previously, uh, this thing was not like this, right? Simply, um, the things were different, and uh, you have to get the reports like this, right? And you have to see the values, or sometimes you have to remember the values, or sometimes uh, you have to take a reference from the books, right? So now, what you can say, the important thing to mention over here is uh, I am telling you these things because, uh, like clinically, these things are important, and I will tell you as we will go further that what values are important and what values you must remember. Okay, uh, what you can say while discussing, because some of the values, even among these things, we must remember by heart, and they are easy to remember, by the way. So, what you can say, all these things are new, guys. Like, for example, uh, uh, the first person you can say who published uh, how red blood cells look like, or when he was able to see the red blood cells under the microscope, was in 1675. Uh, when a person, his name was Anthony Van, he looked his own blood under the microscope, and he defined them like as small red globules. Okay, so it was like, you can say, 400 years back, around 350 years back. So then, of course, like first of all, decades by decades, nowadays, years by years, but now the science have is progressing at a huge speed. Like uh, they invented more sophisticated microscopes and all this thing. And the first, for example, this CBC, or complete blood count, was performed uh, in 1852, or you can say 150 years back, 160 years back, you can say. Okay, and what he did, uh, like he spread the blood on the slide, and he started counting that. Okay, so see, not so old things, by the way. So, and then of course, like they develop new and new microscopes, new and new machines, and the things become easy. day by day. And of course, like nowadays, there are sophisticated analyzing machines which are available, and we can get the results in minutes, okay, by automated analyzers. So thank you so much, guys, for listening. And in the next lecture, we will start with the bloods or hematology.